Hello, I'm Jawad. I'm the Exec Medical Director at East Lancs Hospital NHS Trust. This is my update on the 5th of August 2021. I'll start with the numbers of community transmissions in our conurbation. So in Blackburn with Darwin we have 150 per 100,000, Burnley 324, Hyndburn 201, Pendle 246 per 100,000, Ribble Valley 173, and in Rossendale 201. That brings on an average for our boroughs a number of 212 per 100,000. Reassuringly, the number is getting lower to what it was a few weeks ago. However, as you will appreciate, it is still high, and hence the same message which I have been talking about, that we have to be very cautious. Although the government has lifted all the restrictions, but please follow the IPC principles. If you can socially distance, do that, but hand hygiene, masks would be advisable to prevent cross transmission. As of this morning, we have a total of 33 in total COVID patients admitted. Of these, 11 are in critical care. Critical care is still under pressure, and so is the staff in A&E. We are not seeing any reduction in the number of attendees to our urgent care and accident and emergency department. This is causing a significant pressure on the system, and on some occasion the waits to be seen could be a good few hours, even as long as 5 hours. We have had some very difficult and challenging days. So my plea is again that do approach your GP surgeries. 111 is a good resource, your local pharmacies, where you will get appropriate advice, and if you do need to come to the hospital, then you will be directed to. So please consider that the system and the staff is under a lot of pressure. You probably have heard that the government is recommending vaccination to 16 and 17 years old. Do consider that. It is important because what we are seeing is a higher rate of transmission in youngsters. And as you may have also heard in the news today, that 1 in 5 people admitted into the hospital are less than 35 years of age. And that just shows how effective vaccination has been in preventing severe illnesses in elderly, or for that matter, in a group which is 50 years and above. Role of vaccination in pregnancy has also been made very clear. The government has issued guidance, and again, ladies who are of women bearing or childbearing age should take on vaccination. We have unfortunately seen an increased number of pregnant women being admitted to intensive care unit. So it's important that for women who are pregnant, please consult your GP. You should be able to have the vaccine, and do take that offer. Children are again being seen as attending in bigger numbers to hospital, and that is down to respiratory syncytial virus and other forms of virus, including COVID. Again, the advice is please consult with your GP 111 before you decide to bring your child to the hospital. We have further lifted some restrictions on visiting. Do see our website, which will guide you to what and which wards that are open for visitors. But it's important to know that in hospital we are adhering with wearing a mask, with social distancing, hand and respiratory hygiene. So if you are to attend as a visitor to the ward, we would expect you to adhere to these principles. Finally, it is important that we all remain safe. We follow the IPC principles. We are working hard in this hospital to continue to catch up on the backlog that has resulted from COVID activity. So the restoration is ongoing. There are challenges with self-isolation, with annual leave, with also some patients at this time not willing to come to hospital because of the lifted restrictions, especially travel restrictions. But we are doing our best to catch up on all the backlog that unfortunately resulted from COVID of last year. Stay safe, and I'll update you next time in a couple of weeks. Bye for now.